Hello, my name is Emma Amadrio, and I'm an obstetrician and gynecologist at Nakasero Hospital. In this month of May, the Ministry of Health of Uganda has launched 10 days of activism about preeclampsia. Preeclampsia is the second leading killer of women, of mothers in Uganda. So as Nakasero Hospital would like to remind you, the mothers out there, about preeclampsia. Preeclampsia loosely is a condition where we have increased or elevated blood pressure among mothers that are pregnant from around 20 weeks of pregnancy to up to 6 weeks after delivery. Preeclampsia is a killer, and we'd like to fight it together with you and prevent it, because we can prevent the effects of this condition. The signs of preeclampsia that you may notice when you are at home are as follows: headache, excessive headache that is not responding to the common painkillers like Panadol. If you have headache and it's persisting, you're pregnant, in the weeks that we've talked about, you could have preeclampsia. The second sign is swelling of the feet, the hands, and the face. It is common to have swelling of the feet in pregnancy, especially within the third trimester. However, when you notice that you're swelling the legs, the hands, the face, you could have preeclampsia. The third sign is abdominal pain. Commonly, you may think that you have ulcers, as we say normally. However, before you say that there's nothing wrong, you need to come and be checked for preeclampsia. The other sign is having disturbances in your vision. You may be noticing that you see black spots in your eyes as you look around. So when you have visual disturbances, when light is so painful to look at, you could have preeclampsia. The fourth one is gaining weight of 2 kilograms per week. If your weight gain is 2 kilograms every week in pregnancy, then we are concerned that you could be having preeclampsia. The other sign is reduced amount of urine. If you notice that the number of times you actually go to urinate are reducing and the urine is little, you could have preeclampsia. How do we check for preeclampsia at the health facility? When you have any of these signs, reach out to your antenatal care provider and ensure that you are checked for your blood pressure. If the blood pressure is high, and we say a blood pressure of 130/90 is suspicious, we start to follow up to be sure that you don't have preeclampsia. We check for your urine, so we'll ask you for urine sample, and we check for proteins in the urine. If there are proteins in the urine, a particular level will trigger us to worry about preeclampsia. We may ask you for blood samples to check for the level of hemoglobin or the amount of blood that you have. We may also check for how your liver is functioning, for how your kidney is functioning. We may do a scan to look at the baby and how the baby is doing. In this way, we are able to look at the effects of the condition on you, the mother, and on the baby that you are carrying, to ensure that we have safe delivery for you and for your baby. What are the risks of preeclampsia, and why are we so concerned? As I mentioned, it's a second leading cause of death among mothers. So preeclampsia can lead to death of the mother and the baby as well. Preeclampsia can lead to getting seizures or convulsions. So a mother may start fitting or having convulsions when the blood pressures are high. Preeclampsia as well causes organ damage, that is to the kidney, the liver, the brain, the lungs. So preeclampsia affects the whole body, can cause all these. Another thing that preeclampsia can cause is a stroke, because we say the brain can get damaged. So a mother could carry her pregnancy normally and end up having a stroke. In the baby, preeclampsia may cause death of the baby, may cause preterm delivery, may cause us to have a small baby as expected for that age. So let us work together, the mothers out there, the husbands, the caregivers. Be alert, be attentive. Let us fight this preeclampsia and be able to prevent the effects that come with it. Have a very good month of May.